Alright guys, so this is concept number 8, fluid and electrolyte balance. So for this, the goal here is to define and describe the concept, discuss the risk factors for impaired fluid and electrolyte balance, recognize the causes of fluid and electrolyte imbalance, and provide appropriate nursing and collaborative interventions to promote fluid and electrolyte balance. So fluid and electrolyte balance is the process of regulating the extracellular fluid volume, body fluid osmolality, and plasma concentrations of electrolytes. This is just a cool little thing that shows if your optimal extracellular volume are in the middle, otherwise you can have a deficit or an excess. Your optimal osmolality, so sodium is 135 to 145, and you can go down or too high, and same for potassium, being hypokalemic or hyperkalemic. Okay, sorry, this thing like spazzed out. Let's just go back here. There we go. Alright, so our mechanisms of disruptive fluid and electrolyte imbalance. So if we have a decreased intake and normal output, our ECF, we have an ECF deficit, the osmolality might be too high, and we might have plasma electrolyte deficits. So you can read over all these and just see kind of how the imbalances might occur and what it will lead to. Consequences of imbalance might have impaired perfusion, impaired gas exchange, impaired cerebral function, like we talked about. If we're not having enough oxygen going to our brain, we might pass out. It might lead to a coma. Impaired neuromuscular function, might have muscular excitability, twitching, weakness, stuff like that. So populations at greatest risk are, of course, the very young and the very old. And why are they at risk? Because the elderly especially have less total water volume, so they are at higher risk for dehydration. Symptoms of fluid and electrolyte imbalance are nonspecific. So consider the symptoms in the context of the risk factors present. Red flags might be, for example, are they vomiting? Are they having diarrhea? Do they have organ failure, kidney failure, heart failure, liver failure? And we talked about how those can affect some of the way that fluid is exchanged in the body if the liver isn't working, or the heart, or the kidney. Clinical findings associated with fluid imbalance are dependent on the type of imbalance and its severity. Consider the functions of the following fluid compartments and think about symptoms if there's too much or too little. So intracellular, if there's too much, your cells can swell and burst. If they're too dry, they can shrink and kind of waste away. If there's excess volume in the interstitial space, you can lead to edema, pitting edema, which will lead to a lot of other issues. So just think about our fluid balance and how certain ways will affect how our body functions. And then also think about the functions of the following electrolytes and about what the symptoms are if there's too much or too little. So we kind of talked about that. Potassium can really affect the heart. Sodium can lead to muscle weakness and twitching, coma if it's severe, and calcium will lead to those Chvostek, Trousseau's, facial twitching, those kind of symptoms. So how are we going to measure these levels? We're going to look for the osmolality. We're going to look for sodium, potassium, calcium, magnesium, all in blood tests. And just a basic metabolic panel, you can see all the electrolytes and what are the normal ranges of each. We also talked about in some of the other slides, so I'm not going to go over those again because you can look at the other slide and find all those normals. Plus, of course, they're always in your books. And electrocardiogram, what clues can be gained from an ECG? So if you remember, the big one we talked about is potassium. If you have potassium imbalances, it will often show up on your EKGs. How do we prevent electrolyte imbalances? So teaching our patients how to monitor their chronic conditions, just monitoring their weight, their thirst, stuff like that, watching their diet, watching how much they're taking in. If they're vomiting, if they're having diarrhea, of course we want to encourage them to be taking in more fluids. So there's no screening for fluid and electrolyte imbalance. It's not like we can just kind of go in and just get screened for it. It's something that doesn't always get monitored closely, so we just have to listen to our bodies and what it's telling us. So if you feel thirsty, you're probably a little thirsty, so drink some water. If you're dizzy, maybe you're still dehydrated, so still drink some water. If you're having heart palpitations, maybe your potassium's a little off. So just being aware of those signs and knowing what those are and what they mean. Treatment strategies depend on underlying condition. So if somebody has liver failure and they're suffering from ascites, of course we have to treat the underlying condition as much as we can. Excuse me. Or if they have heart failure, if giving them an extra diuretic, or just kind of really figuring out why these are happening and treating it accordingly. If they need water replacement, we'll give them oral fluids or IV fluids. We can replace their electrolytes via IV or pills, and giving them diuretics, insulin, vasopressin, which is another fancy term for the anti-diuretic hormone that we talked about. And monitoring daily weights, monitoring fluid intake and output, safety, so teaching them to stand up slowly, compression socks, oral hygiene, patient teaching, all that stuff, just teaching them how to control their bodies and just be aware of what their bodies are telling them.